In vascular dementia, there's a couple of things about this. This is definitely memory impairment, right? You're always going to see memory impairment with a vascular disease. It's characterized by either an ischemic or hemorrhagic event that occurs inside of the brain. Okay, but here's the fascinating thing. Abrupt onset and step-ladder decline. Okay, Alzheimer's disease, remember what it is? Here's a roller coaster with the brakes on, going down really slowly over time. What is cerebral vascular dementia? Still going down the hill. But good days, bad days, good days, bad days, good days, bad days, good days, bad days. This is the type of patient where a family member will come up and say, Dad was doing so great yesterday and today he's like Satan. Okay, something like this. This is what family members will say. Today he's the devil in disguise, right? And so that in itself is a vascular type of dementia. Abrupt onset. Don't forget, all of these patients have had either a stroke or a TIA at some point in their lives. Okay? That's what had to have happened. And as a consequence, you see the step-ladder decline. You see patches of intellectual deficits. What does that mean from a recall standpoint? I give somebody recall questions and they have vascular dementia, early stage vascular dementia. They'll get it. They will get it. This is not a temporal lobe disease. Most strokes occur in the middle cerebral artery, parietal lobe. Okay, you see a lot of language problems. You see a lot of motor deterioration or motor dysfunction. Okay, but you see less recall problems. Okay, you'll see focal neurological signs. They're not, maybe hemiparalysis, hemiparesis, okay? And symptoms. The symptoms, you have to have other cardiovascular disease inside of your body, okay? It just doesn't occur in your brain. And what that means is these people are going to be hypertensive. These people may have diabetes. That's a vascular disease, right? Diabetes is not a disease of sugar. That's a big misnomer. Diabetes is a disease of the vasculature, all right? And then the other thing you see is things like hyperlipidemia, high cholesterol levels. I'm telling you right now, this disease has to have other cardiovascular agents associated with it. If you don't see that, there is no way that it's vascular dementia. No way. All right? And then, of course, things like age. Being older increases your risk. Every dementia is that way. All right? Being male increases your risk. Being African American, being Asian increases your risk of developing vascular disease. All right? So what is it that you see? Oh, well, this is an MRI, and even though I can't read these anymore, at one point I could. All right? That will kind of give you an idea of where the disease is actually taken place and what kind of aspects of that disease state should be manifested as a consequence, okay? However, common features that you see in vascular dementia, executive dysfunction. Boy, these guys have a lot of frontal toilet. That's what I call it, okay? Frontal lobe becomes affected because of the ischemic nature of the disease, and whoo, does it come out, okay? All right, consequently, poor word retrieval, decrease in verbal fluency, impairments in motor programming, motor function. He's trying to send a signal to this arm, it doesn't work right, okay? That is consistent with vascular disease. But you know what you see a lot of? Oh God, it's wonderful. Okay, this is why vascular patients are so much fun. Perseveration. Disinhibition, mania, OCD, apathy, mood changes. That's what's fun about these patients, okay? Because they bring to the table mood, and behavior. Oh my God, all right? So what does that tell you from a pharmacological standpoint? Are these people going to require treatment? Usually, yes. Usually pharmacology works for those moods and those behaviors. Okay? Alzheimer's patients can literally go their entire lives sometimes without any treatment at all. Marion, she started out on memory meds. There was a point they were no longer affected. We did have to put her on an antidepressant because she was so anxious. Okay? She had some anxiety. We used that for a while, but towards the end, Marion was on nothing. The last 3 years of her life, she was on practically nothing. She had absolutely no hypertension, no hyperlipidemia. She had no risk factor whatsoever. Okay? Old farm girl this lady was. No risk factors at all for hypertension, cardiovascular causes of her disease. None. Okay? She was a pure Alzheimer's. Pure. This could be. This type of stuff comes right out of vascular dementia, okay? Because there's the inability to incorporate everything that's being thrown into that temporal lobe and getting it circulated around the rest of the brain, all right? What does that mean? You're going to see a heightening of depression. That's the most ubiquitous term you can say for a vascular demented patient. Depression. They become more depressed, okay?